So now I would like to welcome you to today's webinar, Factors for a Successful COVID-19 Vaccination Program, sponsored by CGI. In this webinar, you'll hear from career officials and industry experts from CGI and Johns Hopkins University, who will discuss crucial factors in the successful development, launch, and distribution of a successful COVID-19 vaccination program. Together, our two speakers will engage in a lively discussion aimed at creating awareness of the complexity, opportunities, and challenges in vaccinating the U.S. population during a pandemic. Our speakers today are Lois Privor-Dumm, Senior Advisor for Policy and Advocacy and Director of Adult Vaccines for Johns Hopkins School of Public Health, and Rehana Wolfe, Director and Consulting Expert for CGI. So with that, I will hand things over to Rehana to begin the presentation.
Thank you very much, Bridget, and welcome everyone, and thank you for joining us this morning on a topic that's extremely important. So before we actually get into our conversation, I just wanted to set the pace a little bit for us. And if my slides would just move, we can get started. Okay, here we go. So over the past 8 months, we have witnessed the intense impact that COVID-19 has been having on our society and all aspects of our lives. Such a global pandemic has certainly pushed the boundaries of our scientists, and we have witnessed vaccines development like never before. And what you can appreciate on the slide is that vaccines typically would take over 10 years to be developed. But for the COVID-19 vaccines, obviously that development timeline was truncated to almost a year. There are more than 160 vaccines in development, and potentially we could have a few candidates approved in the coming months. Not only have manufacturers moved at warp speed through their R&D processes, but pharma has also been manufacturing doses at risk, having entered phase 3 trials. Now we are at a point where regulatory authorities such as the FDA and the European Medicine Agency are reviewing clinical trials data. In the U.S., the guideline is at minimum a 50% effectiveness must be demonstrated for any form of regulatory approval. And with a few exceptions, we potentially are looking at a 2-dose schedule to be administered within a 3 to 4 weeks time frame. Now, not only have we seen a fast-paced development, but we are also seeing new vaccines players such as Novavax, among others. Currently, there are 52 vaccines in clinical trials in humans, with several U.S. vaccines in phase 3, as you can appreciate on the slide. We're also witnessing new vaccine technology, for example, Pfizer and Moderna coming for the first time ever with the mRNA vaccines, which certainly brings challenges to the cold chain, as we all know, needing a minus 70 degrees Celsius storage versus a regular cold chain of 2 to 8 degrees for vaccines that are currently in routine immunization programs. This past Monday, Pfizer announced that its phase 3 interim analysis shows its mRNA vaccine is more than 90% effective in preventing COVID-19 in participants without evidence of prior SARS-CoV-2 infection. This is pretty significant given others are seeing potentially efficacy around 50 to 70%. So while we have spent the past 8 months in development, the fundamental and most challenging aspects are now in front of us. That is the distribution and vaccination. And that will be the topic of our discussion for today. Distribution across many channels with periods of limited supply and a phased approach is certainly a complex undertaking. Similarly, education on the different vaccines, their availability, the points of vaccination, are extremely key to reaching that desired 70% coverage of the population. So let's dive into our discussion today at these very fundamental questions at hand when we look at what will it take to have a successful vaccination program considering the distribution and vaccination challenges in front of us. So Louise, to kick us off, I'd like for you to talk to us a little bit about routine versus pandemic immunization. How are these two settings different? And when we look at the allocation, the distribution, and the inventory management of doses in this particular setting, what are the infrastructure needs that are required to set us up for success? And especially so, given we're looking at the adult population.
Great. Well, thanks, Rehana. That's a really great question, and one that comes with a lot of different answers. So first, thinking about a pandemic situation versus routine, you have to remember that in a pandemic you have active disease. So generally for routine immunization, and take the example of seasonal influenza, hopefully you have people that are going to be coming to get their vaccines prior to the flu season starting. So it's a slightly different scenario. In a pandemic, you have a scenario where people are going to have to social distance, so this has implications on when they come and get their vaccines, how they get their vaccines, who they see to get their vaccines based on who they think, which localities they think might be safe for them to go. You also have a much broader population in a pandemic that will be receiving the vaccine, and remember that it's generally within a short period of time. The idea is that you want to get people vaccinated as soon as possible to slow the progression of the disease. Now, compare that to the flu season. So last year's flu season, for example, in the U.S. for adults over 18 years of age, that was 45% of people that went and got their flu shot. During a pandemic, you're hoping that that number is going to approach the level that's going to give you community immunity, 50, 60, 70%. We don't know what the exact number is, but it's a fairly high number of people. So you're looking to get more people in to get their shots at a short period of time. Then some other things that are need to be considered during a pandemic, and particularly this one with COVID-19, is that you need to be able to track all of these people. So when you're vaccinating people that don't normally come in and get their vaccines and are not part of a registry, may or may not have health insurance and be a part of the health program, you have to think about how are you going to know how many people got their vaccines, and how are you going to be able to call them back if they require a second dose. So this is another thing that for routine immunization, even though for influenza you do want to track how many people have gotten their flu shots, it's less important that you're able to call them back. And with the possibility of two-dose regimes, that you will certainly need to be able to do that. So that creates the needs for new systems. And then just the sheer volume in the system that's going through at one particular point in time. Think about the tens of millions of doses that need to be delivered to not just all of the traditional points of vaccination, but we need to also ensure that they're getting to places that maybe haven't traditionally been reached by vaccines, because those are going to be the people at highest risk. So those are just a few of the differences between a pandemic and routine immunization.
Thank you, Lois. And I think that is, to just listen to you go through one by one all the different, pieces of the puzzle that has to be in place, just seems an insurmountable task. And the more I speak with folks, I think the more concern is, are we truly ready for this? And it is going to be an extremely difficult, scenario to manage through. Now, all of that being said, the CDC has issued a phased approach to vaccinating the U.S. population. And so when we look at that phased approach that the CDC has put out there as a guideline, from your experience, Luis, in a setting such as this, and considering that obviously we are going to have periods of limited supply, what is the best mechanism for us to ensure that this phased approach works? Is it that push-pull mechanism, or is it a bottoms-up one, especially also given that the shelf life for these vaccines, at least in year one, is going to be pretty short? I know some of the vaccines will have a 6-month shelf life. So can you talk to us a little bit about that push-pull mechanism or that bottoms-up approach as we look to push vaccines into the supply chain to the vaccination point and getting folks to the vaccination? So if I'm a pharmacy and, how do I, or what is the best way of saying, Rehana, your pharmacy will get 500 doses of vaccines, and then what happens? So how do we go through this knowing that, everybody needs to, but it's a phased approach, different folks at different times, different supply readiness. How do we manage that?
Well, first we need to recognize that vaccines will be allocated, at first at a state level and then at the local level. So although the ACIP provides, or the ACIP and CDC provide guidance on how vaccines should be allocated, ultimately it's going to be up to each one of the states to determine how the vaccines get out to where they need to be. And then it's a very complicated supply chain from there to make sure that we can get them to the places that they need to be. We need to ensure that, as you said, that the people that should be getting them first do get them first. So those are, essentially our frontline health workers and first responders and, other essential people that will protect the integrity of our healthcare system. So you want to make sure that the doses are going out to all of the hospitals, all of the practices, and the places where those are needed. And that will be up to, I believe, each state to determine, that there is integrity in that process and that actually happens. Beyond that, it becomes a little bit tricky, and part of it is determined by, a level of control where the doses go. But then once the doses are at the vaccination points, then there's a bit less control over who actually receives the vaccines. And it will be, again, up to each state and locality to ensure that, who is on that list of being highest risk are actually the people that are receiving the doses. Now, each state is going to have to put their information into a system. So there is one standardized system where they're going to have to enter data to see who is going to be vaccinated. But as we know with systems, sometimes it's, the data don't get entered properly, or there's certain delays. And then you have to have somebody at the other end looking at it to make sure that the immunization rates are going to be handled in the way that we think they are. So we have a lot of very capable people that are working in logistics, working on allocations and things like that. But it is ultimately going to come down to people, sticking to the plans, those that are overseeing how the vaccination goes, and then ultimately understanding whether the data in the system recording who actually is being vaccinated is what we need to determine whether the right people are getting vaccinated or not. A lot of it also comes down to communities, and what's important is a community voice to be able to say that, our community wants this vaccine, but we're not getting it. And this is where the media comes in. This is where community organizations come in. The faith community come in to be very loud and say that, either this is working or it's not working. Now, the other element that we really need to take into account is it's not just the allocation that matters, it's whether people are going to accept the vaccine or not. And this is a really, really big issue.
Yes, absolutely. And we're certainly going to touch on that point because I think that is where the success of the vaccination comes in. Just for our listeners and our audiences, we have 3 poll questions that are going to be scattered throughout our discussion this morning. And so I am going to launch our very first poll question for you. And that question is, which digital outreach medium would best help inform and support citizens' vaccine decision making? And so you have a number of choices: vaccine portal by manufacturers, a mobile app with real-time data and scheduling. What happened there? Sorry about that. Why does this keep moving? Okay, a mobile app with real-time data, public service announcements, text, SMS, email, or a combination of all of these. Now, Lois, while the results are coming in, we were just talking about this is adult vaccination, a segment that realistically has 2 things: vaccine hesitancy, optimism bias. And because of the truncated timeline of the vaccine development and the readiness of the vaccine right out into vaccination points for folks to begin to get the vaccines. But the fundamental question that we have in front of us is, how much do citizens know about these vaccines to make an informed decision? There are a lot of polls out there that are showing that almost 40% of Americans do not plan on being vaccinated, while about 54% would wait to make sure it is safe and effective before getting vaccinated. And certainly if we look at that picture and if it holds true, then the problem we have is early uptake, if it's very low, could affect vaccine confidence in the bigger, broader population. And so this is why the question of which digital outreach medium would best help inform support citizens for vaccine decision-making is so important. So we're going to look at the results as we come down to the end of the session. So let's feed into that, Lois, and go back then to the question of what information should our citizens be currently receiving to help them to feel good about the decision they will make to vaccinate?
Yeah, no, that's a great question, and it's something that I'm experiencing firsthand working in Baltimore City. Right now in Baltimore City, particularly in the African American community, there's a lot of skepticism over the vaccine. And some of the things that we're finding is that people make their own assumptions about the vaccine. They listen to what they hear on the news, they listen to just general chatter and what other people are saying about the vaccine. And, sometimes we forget that there actually is no vaccine yet. so we're making assumptions on and it's natural that people make assumptions based on very early data or what they might think a vaccine could look like. And generally what they're going to want to hear about is, first and foremost, they want to know that the vaccine is safe. And it's not just being told that the vaccine is safe, but what does that actually mean for me? So if I'm a person with diabetes or underlying heart disease or asthma, what will this vaccine do? And what is the difference in the vaccine if I'm, 18 years of age and relatively healthy versus, 70 with a whole lot of underlying conditions? So getting down into the specifics is really important. Now, one of the things that is helpful is that we have, digital information. You can go to CDC, you can find all sorts of information, there, at least as much as we know, or there might be information that you get from Facebook or Instagram or other places where people get their information. But we can't forget that face-to-face information is also important, and that it needs to be from a trusted messenger. So I'll get back to that in a minute. I was talking about what type of information people need to know and what they want to see. They want to know, what vaccines will be available, when they will be available, whether that vaccine is appropriate for them. A lot of the questions that we're getting in Baltimore City, for example, were how many African Americans were actually included in these trials, or how many older people were included and what was the experience there? How many people with particular underlying conditions? And then when you're talking again about safety, and that seems to be coming up as the number one concern, is that what does that actually mean? Now, the other thing to remember is with the safety conversation, sometimes it's not about safety of the vaccine. It's a perception of safety and something having to do with the government. So the question that came up was, okay, are we just pushing these vaccines too quickly, and is there political pressure that's making the FDA approve them, and can I even trust this vaccine? So it's actually more of not necessarily something about, I've heard that this vaccine is going to cause me some type of harm, but it's more a question of, how can I trust our politicians? They're pushing for something and I don't feel comfortable with what they're telling me, and we need to do something different. So it's also about building trust, and building trust with people that they trust, that they've seen the data. Other things that people will want to know is whether the vaccine is efficacious. So, if I get this vaccine early on, the FDA still is saying that their threshold for efficacy is 50%. Well, that sounds pretty bad to a lot of people. So depending on where you are, some people are looking at it from the glass half full standpoint, that in a pandemic where something is really terrible, 50% is a lot better than nothing. And others are thinking that, why would I risk my life with 50%? And those are tough things to address through digital media. They're often conversations, and they're conversations that need to be happening at a community level and in every community. So one of the things that I want to emphasize is that there is a role for putting out general information, so the digital, SMS messages and all sorts of places where we can get messages out quickly to a number of people, but we also really need to supplement that with more personal communication with trusted messengers. That may be a local doctor, it may be a faith leader, a pastor at a church, it may be a community organization. There's any number of people that could be considered trusted, but they need to also be able to access the information. So I've gone in a kind of roundabout way to answer a lot of your questions, but hopefully I've gotten to some of them.
Yes, absolutely. And again, I think we are appreciating the complexity of another aspect, which is the education, right? We talked about the distribution, we talked about the phased approach. Now when it comes to the education, and it's educating not only the citizens, but also the professionals who are working within the ecosystem to help to make sure that the right information gets to everyone, which leads us to our second poll question. And this one's asking, who is most trusted to educate the public on the benefits of the approved vaccines? Is it your primary care physicians? Is it the manufacturers of the vaccines, public health experts, CDC, or a public-private collaboration to the point that Lois was mentioning, community workers, civil society organizations? Who are the players in the ecosystem that you most trust to educate the public on the benefits of the vaccines? And with that said, while the polls are, feedback is coming in, we shall continue our discussion. Now, when we look at the fast pace of the development of the vaccines, Lois, and given the need for it as quickly as possible, I think we can appreciate that very truncated timeline that manufacturers with their scientists went about developing vaccines. So my next question is the adverse event reporting, and how are we going to manage that? Currently, we have here in the U.S. a very passive ERS system. It's dependent on the recipients or individuals reporting back their experience. Would you like to share with me, Lois, some thoughts in the case of COVID-19? What can we do to make sure that because these vaccines are new, we're getting the proper and perhaps very active reporting of adverse events as the population continues to receive the vaccination? Love to hear your thoughts on that. And
term adverse events that people will want to see, that we're tracking over time. So I really hope that what will be happening is that there is some type of active surveillance phase 4 studies that will be required, because that's what will give people confidence. There were, fairly large numbers included in the trials, so that, is certainly comforting. But we also have to remember that these vaccines are new technologies. And, this is the first time that we're using some of these platforms. And so it will be absolutely crucial that we have a handle on what is happening with vaccinations. So hopefully the longer-term follow-up will continue, and with the patients that have received the vaccine, so we get a better sense as to not only from a safety standpoint, but also duration of immunity. So it's not just the safety question. And then having a very transparent and active system to be able to determine what type of adverse events are occurring is important, and in particular populations. So the more that we can, determine within particular race or ethnicity or within particular age groups what the rates of adverse events are, that will be important.
And I think that's in parallel to what we would also say is capturing real-world evidence, correct? How the vaccine is performing in the population over time to help inform, obviously, let's say, for example, this becomes a need for annual vaccinations, such as we do with the flu. Having real-world evidence data over time will also play an important role, correct?
Absolutely. Real-world evidence is important in this whole cycle, and it also needs to be communicated back to the people that are giving the vaccine so they can instill confidence in their patients or the people that they see to be able to vaccinate. And, it's also important that that evidence gets out to politicians and other people that are communicating about the importance of the vaccine, because ultimately we want to make sure that a very large portion of the population is vaccinated. And the trick will be later on to be able to, so first we're going to be going to older adults or the more vulnerable, the people that are more exposed. But if we are going to be stopping transmission of the disease, we need to ensure that the younger community is also being vaccinated. And remember, if they think that they're healthy and that they can weather all of this, they want to be assured that something bad isn't going to happen by taking that vaccine. And so we really do need to have good information and good evidence about, what the effects of the vaccine will be.
Very good. And with that, we will jump into our third and final poll. And the question is, from a regulatory perspective, do you think the policy for developing vaccines could change given our current experience on warp speed development and collaboration? And so while that poll is coming in, there is a question that came in, Lois, and I'm not sure if you have any information, but the question reads, are there any plans for real-world evidence tracking at a state or national level? Do we have any ideas of how that's being planned for the U.S.?
Yeah, I'm sure there is, but I don't have a specific answer for that one.
Okay, very good. So what I will do right now is I will look at the polling results for the first question that we issued, and that is, which digital outreach medium would best help inform and support citizens' vaccine decision-making? And overwhelmingly, 75% of our responders say a combination of all the options that were presented. Comments, Lois, any surprises?
Well, actually, I'm not surprised by when I would answer this. Of course, you put combination of all, because I think it's important to recognize that there's different people. There's different people that have different needs and like to receive information in different ways. One of the things that we need to also recognize is that early on, a target will be older adults who are using digital information, probably not at the level that younger adults would be. So that needs to be taken into account, how that's actually going to work and how you're going to reach that audience. That being said, a lot of older adults are, internet savvy. They do get information there, so we can't just assume that that's not the way to do it. And sometimes the target is not the older adult themselves, but it may be their children or their families or others that are in touch with them that have some type of relationship with them that they would be providing advice.
Absolutely, absolutely. And then we'll go into our second poll results. Who is most trusted to educate the public on the benefits of the approved vaccines? We've got a bit of a split here with 43% saying public health experts, CDC, public-private collaboration, and thirdly, primary care physician. Interestingly, not much came back from the manufacturers who are the producers of the vaccine. So I'd love to hear your comments here, Lois.
Yeah, I'm actually a little bit surprised that primary care physicians came out so low, because a lot of the surveys are telling us that they're one of the most trusted sources of information. But it really depends on the person and the person wanting to know information. I think one of the difficulties here is that depending on who you are, you may go to people that are not even on this list as your trusted source of information. Now, I would be really interested if, I'm looking back and thinking we probably should have put up Anthony Fauci and, determined whether, now I'm sure he's under public health experts, but even in some of the most hesitant communities, like for instance, in the Baltimore African American community, we have heard some comments that, they don't trust the government, but they do trust Anthony Fauci. So, I think it's very specific who different people trust and for what type of information. So when it comes to providing general information, there may be some people that are trusted more than others. And when it comes to more specific information, it may be completely different.
So that brings me to an interesting question, Lois. So we have this vast 300 million and more folks in the U.S. And each one of us, or segments of us, have a different lens through which we view vaccines and therefore color whether we trust to be vaccinated or not. And because we have all these different segments and pockets of varying reasons for vaccine hesitancy, and in a pandemic situation, how do we overcome, what strategy, what technique can we implement to make sure that we're talking to these different segments of folks who, for very different reasons, do not want to be vaccinated? And this question is fundamentally so critical, because if we have vaccines in the different vaccination points and folks do not want to get vaccinated, then we'll have a lot of vaccine wastage. So I'm wondering, what can we do to make sure that folks feel really comfortable from their varying perspectives to be vaccinated?
Yeah, the best thing that we can do to ensure that there's high confidence is really listen to people's concerns. And oftentimes I think we want to take shortcuts. We think that we know what people's concerns are, so we don't necessarily ask them what they think or, what questions they really have. And what I've seen is that having a dialogue, which is something that, admittedly is a messy process. It's slow, it's cumbersome. Being able to reach people and get them together so you can even do this, because it varies community by community. It's not something that's streamlined, but it's something that's really important. And it's important to be able to identify maybe particular communities that have, high degrees of distrust and bring them together with their trusted community members to be able to answer questions. Now, this might be in a town hall format, but it might be something that's a lot smaller, something that people feel comfortable being able to answer questions or feel like they don't have to make a stand on behalf of a lot of people, and because they don't want to see a whole lot of other people going on. So this is all about community engagement and having respectful conversations. And then at the provider level, the provider should be there to ask questions and to not dismiss immediately people's concerns, because oftentimes the tendency is, well, you know what, we know that this vaccine is safe. The disease is much more deadly than, any vaccine that you can get. Well, you may believe that, but the person on the other end is interpreting that as, you don't respect my right to have concerns or to call for more data or to get information. So a lot of it's about listening and coming to the point where you can have a good conversation and answer questions. And there's no easy ways of doing it, but some of the best ways that I've seen is when you have these listening sessions, and even the experts that are providing information don't necessarily come in and correct every single misconception, but they allow that dialogue to happen and then provide the information that they need to provide. And then you get a much different conversation and a different dialogue that can help move things forward. The other thing that's also important is to bring in the politicians. So one of the things that we forget about is, like, we think about the general community or the general public. Well, politicians are also part of that, but they have a voice that can sway people in a way that can be really quite impactful. And I'd put in that category, other community leaders. It's not necessarily that they hold a particular office, but people expect that they have the ability to do something about their questions. And the more that we can have open conversation, I think it's not that we're going to convince them overnight, but the more that you can make that commitment to providing information, eventually people will come to see that that some of their fears can be addressed, or that that their way that the way that they think through the risk-benefit conversation might change, so they understand that the risk of disease is actually much greater than a risk caused by any vaccine.
Yes, absolutely. And another critical question that's often been asked is, how quickly will we get a 70% vaccine coverage? Now, if we look back at the slide that's on screen right now, potentially we know Pfizer's vaccine is one of the likely first ones to be available, but obviously it will be limited. And we also know that eventually others will be online. Do you think that in 2022 we will still be vaccinating the population? Is there an anticipation of how much time it will take to really get through population, even for a 60% penetration?
So that's the $1 million question, and I think it's a combination of, can we get that much vaccine to the population? And I think a lot of it will depend on how many vaccines are available and how much we need to do. I think a lot of it will also depend on some of the other things that we're doing, and does it work? Because we need to remember that there's going to be people in the population that choose to just maybe social distance or stay, reduce their risk in other ways, and think that it's best for them to not even take a vaccine. So the way that the public is going to react is going to be interesting, and I think in part that's going to be influenced by what type of vaccines do we eventually have. Now, one of the things that I did find encouraging was when Pfizer announced their results of 90% efficacy. Now, we haven't seen the data yet, so we don't actually know what that means and in what population or anything like that. So there's still some steps to go, but that's something that I think is going to sway people's minds. You know, all of a sudden you're coming up with a vaccine that looks better than many people thought it might have. And then it's also going to be swayed by, are there any adverse events? And remembering that adverse events may be due to a vaccine, but they may not be. But if public opinion is not believing,
Lois, I think we have lost you. At least I cannot hear you. So while we try to get her back online, I will share with you the poll results from our question on regulatory. And so by and large, 83% of our audience today thinks that there will be a policy for developing vaccines that would be on a speedier timetable, given what we've seen for COVID. And there are some other questions that are in here, and Lois, can you hear me? Che, can you hear me, or can you hear Lois? Because I have lost her.
Okay, I'm back. So sorry about that. I
No,
had another call
okay.
come through at the same time. So, so where were we?
We were talking about the adverse events.
And I think we were talking about adverse. I think we were talking about adverse events in the context of how that's going to affect the overall vaccine uptake and the trajectory to about 70%. So if you have an adverse event that people, rightly or wrongly attribute to the vaccine, that of course is going to slow down uptake. I think it's the million-dollar question, how many people are actually going to get a vaccine. As we've seen even with the elections right now, that surveys don't really tell the whole story. We don't know how people are going to react. And, if a threat is facing you, if you start seeing that there's people that that are losing their lives or being hospitalized or affecting long-term health of that individual, then people change their mind. Even people that said, no way am I ever going to get a vaccine, when they start seeing that threat, that changes that risk-benefit calculation that each person is seeing. Conversely, if you start to see that numbers are starting to go down, people may become more comfortable and think that they don't want to get the vaccine. And, so we've had experience in some previous pandemics, and what we've seen is that rates of vaccine acceptance are not as high as we would have hoped that they would have been. Now, a lot of that has to do with timing of the vaccines, but in certain parts of the world, people are concerned about those safety issues, and so that does have an impact.
Yes, absolutely. So here's my other question for you. You have global experience in vaccines. You've gone around the world, as I have done. Do you think, from all you have seen from developed to developing countries, is there one thing or one model that the U.S. can learn from any other part of the world to make the COVID-19 vaccine implementation a success?
So one of the things that I would take actually from the lower income countries is the use of community health workers and the use of people that are trusted. And once you involve people at a local level, there is a lot more trust. Now, when you're giving injections, this makes it a lot more difficult because then, the question is, do you need somebody that is more trained to be able to administer a vaccine? And they use community health workers in different ways, so they may not necessarily give injections, although there's probably no reason why they couldn't give injections except for, well, there is reasons because of the regulatory or legal concerns around doing that, what each state requirements are. But they do provide information. And the thing is, they are able to provide more time. So they're able to have the conversations that they need to be having with families about the importance of vaccination. And that's a model that has worked within a community, particularly if they're a trusted source of information in the community. There's also another question up here about pharmacists. And one of the things that we've seen is also that around the world where pharmacists are able to administer vaccine, that really helps increase uptake. And we find that even within the U.S., the places where pharmacists can give vaccines, that helps increase vaccination. There's an element of convenience that is important, and being able to go to someplace, maybe particularly if you're getting medications already or going to get other types of supplies, that could be something that could increase immunization rates. And we find that expanding the number of people that are able to give vaccinations can be really important. The other thing that is also important, and again, I want to go back to the concept of communities of color and the idea of trust. Having people that look like you can also be important. So when we're thinking about even community clinics, getting local nursing schools or different groups together so they're working within their community, that can also make a difference. So there's a number of things that are happening around the world. And I would say that there's not one single thing that could be applied across the board. A lot of it depends on the particular community.
Yeah, I just wanted to, there's one question, what degree must it be kept at? Sir, I didn't get it the first time. To the person who asked this question, the reference that we were making to was the mRNA vaccine that needs to be stored at a minus 70 degrees Celsius. So I hope that answers the question. We do have another question.
Just one other thing on that. We need to remember that that's just one single vaccine. We may have other vaccines that have other storage requirements. So the mRNA vaccines will require that sub-freezing temperature, but there is variation between the vaccines. The other thing, so some of the other vaccines may be able to be stored at refrigerated temperatures. We hope that there will be a variety of different vaccines. Now, what that does is it creates complexity in the process, and it creates complexity of which locations can take which types of vaccines. So it becomes a question of who can actually get what at which location.
Yeah, absolutely. And that segues very nicely if we focus a few minutes on just digital solutions in a vaccination setting before we close out today's session. So there are a few questions on, what digital solutions can help in a successful distribution of the vaccines. questions around, what portability of vaccine records can be implemented specifically in the setting for adults. Obviously, infant immunizations in a routine setting, we do have the immunization cards. But I wonder if we could spend a minute, Lois, and talk a little bit about portal digital vaccine records for the adult segment.
Thanks for asking this question. And it's something that, I feel even personally. So I think it's not unusual for an adult to maybe belong or to access care at different health plans. And I think I have, 3 or 4 different portals or 5 different portals that I go to. So one of the things that I think is really crucial is, can we think about this as an opportunity to really standardize vaccine information in one place? Now, the tricky part is it's not just the vaccine registries that we need to be concerned about, because from the patient perspective, you're looking at all sorts of health information. So any type of digital solution really should be able to talk to other types of systems. Now, it's tricky, and I know that I'm working right now in the state of Maryland, where the digital products right now are less than ideal, and it's not something that I fault them necessarily on, but it's tough because you need to ensure that you have confidence that when you enter something that it actually appears, that you can find your record, that these digital portals or registries are tricky things, and making sure that they work appropriately is something that's going to take a while. This is probably one of the biggest areas that, I think in data, we need a lot more investment and a lot more ability to be able to analyze what's happening, to be able to locate, where are parts in the communities that aren't being immunized, because that's going to tell us, where we have some of our risks, and ensuring that we're able to get those callbacks there so people get their second dose of vaccine. So all of those things are going to be really important, and digital data is really part of the solution.
And yes, I know the health system is fragmented, where there's not an integrated approach, and all systems talk to each other. And I do not have, as an adult, a portability app, for example, to say, okay, I've had my flu, I've had my shingles, I've had my pneumonia, I've had my COVID vaccines, and if something happens to me, I know what all my vaccines that I've had. So there is a need for such a solution, obviously. But when we look into the bigger ecosystem, and I know time is coming up, and as I watch the clock count down, there certainly is a big need for us to work together, I think, as stakeholders, to build that digital strategy that will have sort of comprehensive solutions for, if nothing else, at least we can start with vaccination, because it is all populations that need to be vaccinated. So while we come up on time, just some closing thoughts from you, Lois, as we head down the wire.
So actually, I'm excited about the prospect of vaccination, and it's a process where I think one of the things with COVID-19 is that hopefully this will be the time that we start thinking about what are some of the fundamental infrastructure that needs to be there for the long term. I think the other thing that we really can't ignore is the need to ensure confidence in vaccination, and that's going to require the involvement of every single person, really educating themselves about what vaccines do and what they don't do, about having thoughtful conversations and respectful conversations and giving people access to people that may be able to answer questions. So it's an enormous process to get the vaccines out there and get them to delivered to all the places that they need to be. But hopefully at the end of this, we'll have a stronger platform for vaccination going forward and higher vaccine confidence.
Okay. I'm going to jump in here before we go today. I just have a couple of reminders for our audience. A survey will pop up on your screen at the end of today's event, so if you would take that and share your thoughts with us, we would really appreciate it. Finally, today's session will be available on demand for 1 year at the HIMSS Learning Center. Thanks, everyone. Have a great day.
Thank you.